Medical spending significantly increases with age because of emerging lifestyle diseases, issues associated with the normal aging process, and increased consciousness about one's health or well-being. People over the age of 65 have the largest out-of-pocket expenses compared to any group. A lot of older adults are covered by Medicare even though it doesn't cover common healthcare needs, including hearing, vision, and dental care. Besides, Medicare doesn't cover long-term, but only short-term, care. The healthcare needs associated with age requires older adults to be insured or be able to afford care, a phenomenon greatly challenged by the fact that a lot of older adults have constrained incomes. A quarter of all Medicaid beneficiaries, which is around 15 million Americans, spend approximately a quarter of their income on healthcare-related services, while 12% spend half their incomes on out-of-pocket expenses. Out-of-pocket expenses are higher for Black compared to white Medicaid beneficiaries, with Blacks being twice as likely as whites to complain of cost-related problems associated with their healthcare. 10% of older adults had an unpaid medical bill as of 2018. Older adults from minority communities, as well as those who are divorced, are more likely to report that they have medical debt. Unpaid medical bills are the most common among adults aged 65 years or older with an annual income of between $15,000 and $35,000. Medical debt impacts older adults significantly, with the most common outcome being forcing 34% of older adults to skip or postpone medical care because of costs compared to 6% of those who don't have medical debt. Veterans and older adults are also affected by large medical bills that result in debt. Service members and veterans constitute 10% of all people who have medical debt, with most of the complaints arising from seeking care in non-veteran affairs healthcare facilities. Veterans Affairs does pay for care in instances where veterans get care from non-veteran affair institutions, but not all the time. This phenomenon results in veterans accruing medical debt when seeking care under the belief that it will be covered by Veterans Affairs. In other instances, healthcare facilities refer debts that were supposed to be paid by Veterans Affairs to third-party collection agencies. Veterans' medical bills prevent them from accessing credit, create difficulties in securing housing, and jeopardizes future employment opportunities. The American Rescue Plan has ensured that veterans are not charged co-payments or any other cost-sharing required in seeking care. Veterans Affairs has recently enacted changes for better support to veterans, with these changes including reporting debt after exhaustible collection efforts, when the debtor is not catastrophically disabled, and when the debt is more than $25. Even though medical debt might appear to affect older adults more significantly, young adults are not left behind. 31% of adults under the age of 30, compared to 24% of those between 30 and 64 years, have issues settling their medical debt. Medical spending increases with age but debts in collection do not. More young people are seeing their debts go into collection compared to older adults, with the peak being 27-year-olds whom 11.3% saw their medical bills go into collection in 2016. An even larger share of young people report having trouble settling their medical bills, with median medical debt balances peaking at $684 at age 26 then subsequently declining with age. Young adults are less likely to be insured compared to older adults, with 15.6% of those aged 19 to 34 being uninsured compared to 11.3% of those aged 35 to 64 years, or less than 1% of those above 65 years of age. The lack of insurance is commonly used to explain why young people struggle with medical debt despite their reduced healthcare needs. Underinsurance results in increased medical debt for young adults because they cannot afford the cost-sharing required by their insurance plans. The whole insurance situation among young adults has been worsened by high-deductible health plans, HDHPs, and short-term, limited-duration insurance, SLD, that have largely been marketed to young adults. Young adults also have the lowest incomes in age comparison indices. The median weekly earnings for 16 to 24-year-olds was $625, versus $935 for 25 to 34-year-olds, $1,149 for 35 to 44-year-olds, and $1,169 for 45 to 54-year-olds as of 2021. Young people also have fewer assets, more student loans, and are more likely to move around a lot, thereby making it difficult for medical providers to track them down for billing or even consistency in healthcare services provided, including patient follow-ups.